The occipital-atlantal joint, OA, is an important component of the complicated anatomy of the suboccipital region. A combination of dysfunction in the motion and positioning of the joint, abnormal tension of nearby muscular and ligamentous structures, and compression of the significant cranial and spinal nerves is thought to be a contributor to pain experienced in certain types of headache. Treatment of the region with osteopathic manipulative medicine may improve joint biomechanics, autonomic tone, and circulation of the region. Approximately 50% of cervical flexion and extension is due to the OA joint. Flexion motion at the OA occurs with posterior glide of the occiput, while extension motion occurs with anterior glide. Other minor but clinically significant motions of the OA joint include coupled side bending and rotation in opposite directions. These motions are due to the occipital condyle's convex arrangement on the atlas's concave arrangement, as well as the anterior convergence of the occipital condyles. Coupled motion of side bending and rotation involves one occipital condyle gliding anteriorly while the other glides posteriorly. Somatic dysfunction of the OA joint may occur because of restriction in the anterior or posterior glide of the occiput, or the coupled side bending and rotation motions due to ligamentous attachments and joint orientation. To diagnose the OA joint, the physician may use the lateral translation test via holding the head while monitoring the OA region with the middle fingers and translating the head left to right and right to left. This motion induces the biomechanical motion of rotation and side bending to opposite sides. For example, motion of freedom in right to left translation would indicate the joint is side bent right and rotated left. Motion is checked in flexion, posterior glide, and extension, anterior glide, for freedom or restriction. Tissue texture changes and tenderness at the OA may also be used to diagnose which occipital condyle is restricted. One technique for treating OA joint somatic dysfunction is post-isometric relaxation muscle energy. This type of muscle energy enables reflex inhibition of muscles, which allows for an increase in muscle length. With the patient supine on the treatment table, the physician then adjusts the occiput in appropriate amounts of flexion, extension, side bending, and rotation to engage the restrictive barrier of the OA joint. In this example, we will treat the diagnosis of OA flexed, side bent left, rotated right. One hand placed under the occiput monitors the occipital muscles with the first finger and thumb, while the other contacts underneath the patient's chin. Position the patient into the barriers of extension, side bending right, and rotating left. The patient is then instructed to turn their head gently away from the barrier by slightly nodding their head forward, side bending left, and rotation right for 3 to 5 seconds, while the physician provides an equal counterforce. Push here for 5, 4, 3, 2, 1, and relax. After the patient relaxes, the physician waits for a period of muscular isometric relaxation before taking up the slack and engaging the next restrictive barrier. Push here for 5, 4, 3, 2, 1, and push here for 5, 4, 3, 2, 1. This process is repeated 3 to 5 times or until no further improvements are made. The physician then rechecks the OA joint motion to ensure improvement. Treating a diagnosis of OA extended, side bent left, rotated right, involves the same hand placement, monitoring the occiput with the first finger and thumb, while the other hand contacts the anterior aspect of the chin. Engage the restrictive barriers of flexion, side bending right, and rotating left. Instruct the patient to lift the chin and side bend left while maintaining an equal counterforce. As before, maintain the contraction of 3 to 5 seconds, Allow for relaxation, take up the slack to the new barrier, and repeat 3 to 5 times until improvement and reevaluate. Push here for 5, 4, 3, 2, 1, relax. Push here, 5, 4, 3, 2, 1, relax. And push here, 5, 4, 3, 2, 1, and recheck. Muscle energy is a safe and effective treatment for the OA joint. However, contraindications to the technique may include medical conditions that affect the cervical spine, such as osteoporosis, fracture, dislocation, joint instability, spondyloarthropathy, tumors, neurologic symptoms with rotation of the neck, or patients who are unable or unwilling to follow a physician's verbal instructions.